I just love them. You can't see them, nobody notices that you have them on, and it just makes it easy to have.
I would definitely recommend these braces to anybody because the results are quick. The way my teeth have formed, it's gotten tons better. My parents have loved the improvement.
My friends said they already have braces, but they said if they had the choice, they would have gotten these because nobody can see them.
Each year, in the United States alone, about 2 million children and adults begin orthodontic treatment, but there are many more who could benefit from improving their smiles. In fact, approximately 77 million people over the age of 15 who visit their dentist regularly are reported to have some type of malocclusion. For most of these, an improved appearance is likely to be the most compelling factor in opting for orthodontic treatment. Still, with interest in cosmetic dentistry growing each year, the market demand unquestionably exists for a faster, more affordable orthodontic solution. And this is where MTM promises to open a new and profitable revenue stream in orthodontics. Dr. Roncone is a practicing orthodontist, international lecturer, and founder of Roncone Orthodontics International.
The return on investment is absolutely incredible. There is no big lab fee. You're not paying $1,800 or $2,200 for a lab fee. I don't have to spend lots of time on a computer deciding how we're going to treat the case because all you do is to put the wire in and it basically treats itself. It saves me lots of time.
MTM is a self-ligating lingual bracket system that typically achieves aesthetic correction of the anterior, upper, and lower teeth in just 3 to 4 months. Completely undetectable, MTM provides excellent, clinically correct results with an easy-to-use, cost-effective solution that puts treatment control back in the hands of the orthodontist. The heart of this new system is GAC's MTM bracket. Extremely small at only 2 millimeters wide, the brackets are placed just below the incisal edge, offering little discomfort or interference with speech. GAC's easy-to-open and close patented clip makes wire insertion nearly as fast as it would be for a labial placement.
Profiling a patient that might be ideal for MTM, you would think that we would be looking at mostly women, some businessmen, but mostly women, maybe from 25 to 45 or 50 years old. And that truly is, if I were going out to market it, that's the type of person or the age that I would go to market. The unusual thing is that probably 40% of the people we're treating are teenagers who do not want to go through full braces, who have been through full braces either in my office or some other office where they didn't wear retainers and they had some slight relapse. The market is still, I'd say 80% women, 25 to 45 or 50 years old, who want to do something about themselves, and some of them don't want to go through full braces. And when you tell them that you can straighten their teeth, that you can give them a good smile, they don't have to have full braces, and you can do it in anywhere from 2 months to 4 months. That's very attractive to them. Most of my patients aren't coming in for MTM. They're coming in for aligners, or they're coming in for regular braces, and when we give them MTM as one of the choices, it's like they're incredibly surprised and say, yes, well, of course we want to do that. People who are using MTM are really pleased with the results. They're pleased that there's very little, if any, discomfort. They are pleased that things happen so quickly. They're pleased that it's relatively inexpensive, especially when you tell them what for example, any of the other retainer type appliances would cost, and you give them something that's usually less, and they can get what they want in a very short time.
Applying MTM brackets and placing the arch wires is a simple process, remarkably similar to a conventional labial procedure, and it typically requires only about 30 minutes of chair time to complete. First, the teeth are isolated. Drying triangles are inserted to ensure and maintain a dry working area. Cheek retractors are inserted. Then the lower anterior teeth that are to be bonded are individually polished and thoroughly rinsed to prepare them for conditioning with an etchant, such as GAC's Neobond Gel Etch. Proper conditioning is essential to ensuring a good, reliable bond between the tooth and the bracket. The etching gel is applied liberally to each tooth. It should be allowed to remain on the teeth 20 to 30 seconds after the last tooth has been treated. Then, it is important to thoroughly rinse away the etching gel. If any is allowed to remain, it can become a significant contributor to decalcification of the teeth. It is recommended to devote about 30 seconds per tooth to removing the etchant. It is equally important to ensure that the teeth are completely dry after rinsing, since most bonding materials are hydrophobic in nature, and a dry base is essential to a strong bond. For proper drying, it is recommended that a small dryer be used in addition to air from the air-water syringe. Once the teeth are completely dry, a suitable sealant, such as Neobond primer, should be used to seal the surface enamel prior to bonding. Now, with the lower teeth fully prepared, it is time to begin placing the brackets. MTM brackets are extremely small, consistent with providing a comfortable lingual placement. The bracket is now placed behind the tooth, virtually unnoticeable except under close inspection. Once in place, each bracket is adjusted carefully to an ideal position, 1 to 2 millimeters below the incisal edge. Subsequent brackets will be positioned at the same distance from the incisal edge to ensure proper alignment at the end of treatment. Each of the lower brackets is now placed and positioned in sequence. While many, if not most patients can be accommodated by treating only the 6 upper and lower anteriors, some patients, such as this one, may call for bonding the first bicuspids as well. This is recommended when severe crowding is present. It permits placement of a crimpable stop to be placed mesial to the bicuspids, where it can assist unraveling the anterior region. Once the last bracket has been placed and positioned, the assistant proceeds to fully cure the brackets with the curing light. Illumination strength varies between different instruments. However, depending on the characteristics of the individual curing light used, 5 to 10 seconds on each side of every bracket is recommended. With the brackets fully bonded, the assistant measures the length of arch wire that will be required. While the choice of wire is at the clinician's discretion, Dr. Roncone strongly recommends the use of GAC's Centilloy wire.
In my lectures, I tell people that if they are not using Centilloy wire, they're missing the best thing in orthodontics. All titanium wires are not equal. Centilloy is far and away the best kind of wire that you can use as an initial wire. The small diameter that they come in, especially for this MTM 012, makes it very simple, and the forces are very light, and these wires do not distort. That makes it just really, really simple and predictable.